The Trump administration is expected to unveil its health care plan sometime next month. According to reports, it will lay out an alternative to the Affordable Care Act, cover pre-existing conditions, and offer a variety of insurance options. The timing of the release could coincide with the third Democratic presidential primary debate.
So health care is a top concern for voters, and many Democratic candidates are expected to once again push Medicare for All. But in his book, The Case Against Single Payer, How Medicare for All Will Wreck America's Healthcare System and Its Economy, founder and CEO of Juniper Research, Chris Jacobs, explains what he says are the negative implications of the plan. He joins us now to discuss the book as well as the healthcare proposals being circulated. Chris, thank you so much for joining us.
Thanks for having me.
So Chris, we talk a lot about a Medicare for All on this show, and I know you have laid out some of the arguments against it. I would say, what are the top three reasons why you don't think it's the proper concern, while recognizing that the healthcare system in the country is terrible right now?
Sure, we do have problems with our healthcare system. I think $32 trillion in federal government spending when we already have $22 trillion in federal debt. The taxes needed to pay for that system, and then the poor quality of care. We've already seen it with the VA system, that veterans who survived wars in Iraq, Afghanistan, overseas, they couldn't survive their encounters with the VA bureaucracy that was manipulating waiting time targets for political purposes. That provides some indication that we would get under a single-payer system.
So a couple things. Number one, isn't that an apples to oranges comparison? Because no one's talking about using the VA system, they're talking about using the Medicare system and expanding that. And number two, on the tax piece, those numbers ignore the costs that are today borne by consumers that they would no longer be paying. So I think it's not fair to look at that $32 trillion number without comparing it to the unbelievable amount of costs that American consumers are shouldering today.
Sure. So the system actually, the Bernie Sanders and the Job Hall bills, they actually abolish Medicare. And even an analyst at the Urban Institute said that it's fundamentally misleading to call it Medicare for All, when in reality it abolishes the current Medicare system and creates something new. In terms of savings and would people come out ahead or not, Ken Thorpe, who's a Democratic economist, worked in the Clinton administration, did an analysis in 2016 that found that 71% of individuals would pay more under Bernie Sanders' plan, even discounting the fact that their premiums and their deductibles would go away. 71% of individual households would pay more. 85% of low-income Medicaid households would pay more. I don't think that's the kind of reform Americans are looking for.
I think it's fair to say, though, other analysts disagree with that.
Some do, but we've just seen, actually in this month, the Heartland Institute put out another study saying that individuals would pay more on net under a single-payer system.
Chris, what we want to focus on here is, how do you lower the cost? So this is the Bernie Sanders proposal in order to cover everybody. Is there an alternative view for how do we dramatically lower cost in this country to the American consumer on healthcare? What can we do about it?
Sure, I think you have to get the incentives right. I think right now making healthcare free for everyone, no deductibles, no co-payments, would actually encourage consumption of healthcare and would encourage overconsumption of healthcare. I think we need to get the incentives right. Everybody is very good at using other people's money in the healthcare system. Obviously, you're not going to require somebody to shop for healthcare when they're in their ambulance on the way to the hospital having a heart attack, that sort of thing. But I think we do need to reform the incentives, because
the providers, right? Because I mean, the hospitals and the providers and the monopolies in that industry are the people who set these completely fake prices whenever it comes to healthcare, and then we end up just reimbursing them at their word with no unless there's egregious fraud. We just end up in reimbursing them.
And you're pointing out a very valid point, because Obamacare has encouraged the consolidation within the healthcare sector that Democrats certainly don't want to acknowledge. Hospitals are buying other hospitals. Hospitals are buying up physician practices. They want to get more market clout so they can jack up their fees. Exactly. Nobody on the left wants to talk about that, and that's one of the reasons why we have the mess we're in currently.
I think that's an important point and a fair one. How do you change those incentives, though? Because, looking at it in terms of Medicare for All versus an alternative, part of what's driving this bizarre system we have now is the profit motive, is the fact that you can take a $3 vial of insulin and charge $320 for it, is the fact that doctors and hospitals have to spend so much time and money dealing with the bureaucracy of trying to get these claims paid, and that health insurance companies, rather than focusing on people being healthy and having care, are much more focused on denying expensive procedures when and how and wherever they can.
So, for one thing, I think the profit margin in healthcare, I wouldn't want to say it's non-existent, but it's minimal. Health insurers' profits are less than 1% of all total healthcare spending. So the idea that we just abolish profit, they're
making billions.
There are not-for-profit insurers. There are not-for-profit hospitals. The idea that we can abolish profit in healthcare and everybody can get all the healthcare they want without limit, all for free, I think that's a false choice and a false premise.
But tell me what the alternative is. How do you change the incentives so that we're focused on good care rather than the Sackler family getting another billion from OxyContin?
Sure, I think you do. On the prescription drug, you need to encourage more generic manufacturers to bring down.
Or, right now, Medicare, as I understand it, cannot bargain with the drug in terms of drug price. It's the largest insurer in the United States, and we're not allowed to bargain with the drug companies. We just pay whatever the price they set is. That doesn't seem to make much sense to me.
So Medicare, the private plans do negotiate with and this is the thing that the Congressional Budget Office has said. You can have negotiation if the government negotiates, but unless you have a stick, unless you're willing to impose a formulary and to reduce access to drugs, drug negotiation isn't going to save any more than what the health insurers generate now in terms of savings. I do think, like I said, it's bringing back competition. I think the FDA, particularly under Scott Gottlieb the past few years, has been very good in accelerating approval of generics to the marketplace. So it's more of that kind of thing right now, and reforming some of the opacity behind the healthcare. Nobody knows what does it cost when I get an MRI. And you really have no
and I don't think they know, Chris. I think that's the true thing, is that this is all fake. It's all just a complete sham in which they've consolidated. They can set whatever price they want. They can jack it up by 60%. They don't have to justify who it is. And the federal government just reimburses this cost with no investigation. Like I said, it's only through the most egregious Medicare fraud that CMS or any of these other people actually do anything about this. Look, I'm undecided on the particular healthcare question, but the major issue to me is these providers. And so, have you actually seen any proposals from any of the Democratic candidates on changing the way that providers are able to charge?
So I don't agree. I don't agree with Javier Becerra on much, but he actually filed suit in California against Sutter Health for anti-competitive monopolies that the price of care in Northern California, because Sutter Health is kind of these exclusive provider contracts and whatever, is much higher than it is in Southern California. So I certainly agree that we need to do more robust enforcement of antitrust and reform and kind of break up some of these monopolies in the hospital sector. Democrats really want to beat up pharma companies and health insurers. Pharmaceutical spending is only about 10% of healthcare costs overall. Really, a lot of the spending is the hospitals and how they have consolidated, prompted in part by the incentives under Obamacare.
Yes.
Yeah, but come on, this is a problem that pre-existed Obamacare. I'm not a huge advocate for Obamacare. I think it was a bit of a mash. I think we should have done single payer, something more dramatic, at least a public option at the time. But these are issues that predated Obamacare. I think the real question that people have, and part of why Medicare for All is so popular, not just with Democrats, but really with Republicans and independents as well, is that we look around the world and we see every other developed country in the world providing their citizens health care as a right with lower costs and in many cases better outcomes than we get here. And we say, why can't we do that too?
Well, first of all, there's nothing in Bernie Sanders' bill that actually makes health care a human right. You have the right to get your health care treatments reimbursed and paid for if you can find someone to take care of you. There is no guarantee in Bernie Sanders' bill that you will get treated by within X days or this procedure or have access to any of that. You see in Great Britain, we have over 4 million people on waiting lists for procedures. In Canada, over 1 million people on waiting lists and procedures. Canada's Supreme Court, several years ago in 2005, actually nullified a provision in Quebec that abolished private health insurance because they said access to a waiting list is not access to care.
But I don't think anyone is saying those other systems are perfect, but are they better than ours? The outcomes would suggest that they are. And if you asked a Canadian, the guy who instituted their universal healthcare system, they voted him the best prime minister of all time. This is their favorite guy. They would never trade what they have for what we have.
I actually have it laid out in the book. Canada performs worse on a lot of access to care metrics than the United States. High waiting times in the ER, I think the highest.
But on health outcomes.
I mean,
those are health outcomes.
I mean, look,
if you have to
our
wait
life
a day or two,
expectancy is dropping. So
if you have to wait a day or two to see a doctor, to see access to care, Canada's even on primary
we see
care.
Mortality rates actually falling in this country. I mean, you can't say that the system is amazing and great and we can't do anything better. That's why I think that there, like I said, is such support for a universal system, because we see other countries doing it and having healthcare that is better than ours. Why can't we, the greatest country on earth, do something that is even better than what Canada has?
So mortality rates, a lot of that is a function of the opioid crisis,
which was driven by big pharma's profit incentive.
Well, it was also driven by incentives that encourage people to overconsume opioids. So and encourage that. I wouldn't say that
and
that's
government reimbursement of those costs.
And government reambrsement of
and
those
doctors
costs.
being feted by pharmaceutical companies who take them on golf outings.
It was an unvirtuous cycle, I guess.
Right, but the bottom line was that the Sacklers made $1 billion off of Oxy, and that's why we have the opioid crisis.
I think that. Point taken. I think that oversimplifies things, but the fact that that we have a system right now, it's a bifurcated system. I think the funny thing is that Democrats are in agreement that Obamacare has failed. Barack Obama promised that premiums would go down $2,500 a year. Nobody's premiums have gone down.
Yeah.
I think the question is, are we going to double down on a system that even by Democrats' admission hasn't worked, or are we going to pivot and hopefully try something different?
I'm hoping for something different too.
Me
Thank
too.
you so much.
Thank you, Chris. Really
Great having you.
Yeah.
Appreciate it.
Next on Rising, America changed permanently after 9/11, especially its security infrastructure.
The former deputy director of the CIA Counterterrorist Center provides context for the birth of the Department of Homeland Security and controversial prisons like Guantanamo Bay. That when Rising continues.